Hi, Dr. Kevin Windisch from Sparks Pediatric and Adolescent Medicine here. Welcome to our video series for students. And for those of you who follow this series closely, yeah, I'm reverting back to an older format for the sake of this video. And we're doing that really because this video is not amenable to a lot of graphics and not amenable to a whole lot of even literature citations, so I don't want you looking at a black screen the whole time, so I think you'd rather look at my face. Please remember that while we're happy to see you here and see your children here in the office for consultation, if you're a parent watching this, we can't help you over the internet. We'd be happy to schedule an appointment for you at area code 775-359-7111. A question came up from one of my students this week, and I thought it was a good one, and I wanted to share with everybody here on YouTube. And the question was, why is it pediatricians, unlike other doctors, only get one blood culture and everybody else gets, as opposed to blood cultures times 3? Why do you do that? And my answer to the student was, we don't do that. Now, if you've taken a pediatric rotation somewhere and you've worked with pediatricians, you realize, well, wait a minute, that's not exactly true. And my answer to you is, it is paradoxically true, but paradoxically, what am I talking about? When you blood culture a patient, you need to think about what is your motivation for the blood culture. What are you looking for? What are you trying to diagnose? And then order the test that'll diagnose it. In the case of pediatric patients, when we're blood culturing them, we're looking for sepsis, bacteremia. In the case of bacteremia, you increase your sensitivity by increasing the volume of blood you take out. The most sensitive blood culture would be to completely siphon the patient, culture absolutely every drop of the patient's blood, and see what grew. Of course, that's not compatible with life, so we take just a small portion of that. But that is really what you're after here. Okay? In the case of adult medicine, when they're blood culturing times 3, what is it they're looking for? They're not looking for bacteremia or bacteremic sepsis per se. They're looking for rheumatic fever and rheumatic heart disease. Okay, so subacute, well, specifically subacute bacterial endocarditis as a result of rheumatic heart disease or other heart damage. Okay. In that case, you could, because the bacteria is shed only intermittently, you could conceivably siphon the patient completely of their blood and still have a false negative. Why? Because if it wasn't being shed at this minute, then you're going to miss it. To have the ideal test, you would just go and section those heart valves and culture them and see what grew. Except, of course, you can't do that. So your proxy is to look in the blood, and because it's shed intermittently, you need to sample intermittently to try to increase your sensitivity and hope that you're going to pick up something when the bacteria is being released. We don't deal with a lot of subacute endocarditis in pediatrics. We do, I mean, we see it, but it's pretty rare because we don't have patients walking around with 30 years worth of rheumatic heart disease. And so as a result, we're not ordering blood cultures times 3 a whole lot. However, there are patients where we're worried about endocarditis. And when we're worried about endocarditis, that's exactly what we do, is order blood cultures times 3. And in the case of adult medicine, if what you are worried about is sepsis, bacteremia, then that's precisely what you order. Blood cultures times 1. The problem is so many people get into knee-jerk medicine that they're ordering whatever it is they order most of the time, and they don't even think about why they order it. So, you know, or they just oversimplify it. Well, it's because this is what you do with a kid and this is what you do with an adult. No, it has to do with what you're looking for. Different diseases require different tests to rule them in or out. So I hope this has helped to enlighten you as to one of the mysteries of pediatrics. It really isn't a mystery. It's not a pediatrician thing per se. It just has to do with the fact that we're looking for different diseases. This is Dr. Kevin M. Windisch. If we can be of assistance here, give us a call at 775-359-7111. We'll talk to you next time.